The brief summary of the paper, titled Clinical Features and Outcome of Septic Shock in Dogs, 37 Cases 2008-2015, was published by Summers, A.M. et al. In the Journal of Veterinary Emergency and Critical Care San Antonio in 2021. Introduction: Septic shock in humans is well defined, but less so in companion animals like dogs. Human survival rates for septic shock range from 13% to 72%, while a 2010 study showed that septic dogs had an 84% survival rate if they had no organ dysfunction, 46% if they had two dysfunctional organ systems, and 10% if they required vasopressor therapy. Methods: the study used data from the Ohio State University Veterinary Medical Center, (CU), from January 2008 to February 2015. Inclusion criteria were specific, focusing on dogs with systemic inflammatory response syndrome (SIRS), a confirmed or suspected infection, and hypotension severe enough to require vasopressor therapy. Results: 37 dogs met the inclusion criteria. No significant differences were found in baseline demographics between survivors and non-survivors. Survivors were more likely to have a gastrointestinal source of sepsis, P equals 0.012, and less likely to have respiratory dysfunction, P 0.0001. Patients who received antimicrobials within 3 hours of sepsis diagnosis had a 35% mortality rate, whereas none survived if they received them after 3 hours. Survivors received approximately 4 out of 7 possible interventions, whereas non-survivors received approximately 2. The Appleful score was a statistically significant predictor of mortality, P equals 0.014. Discussion: the study is the first to investigate potential treatment effects in canine septic shock, were identified as important determinants for survival, early antimicrobial administration, and feeding tube placement. The study suggests that the Appleful score may be useful for future research in stratifying septic shock patients. This study provides valuable insights into the clinical features and potential treatment strategies for dogs suffering from septic. It also highlights the need for further research, particularly in the area of early intervention and treatment protocols. Thank you for watching the video, and if you like it, please subscribe our channel.